Good afternoon, ladies and gentlemen in the auditorium, as well as those of you who are online watching on Zoom. Welcome to the Head Foundation Dialogues. Is everyone in? Yeah, so today we have the topic of the science and strategies of managing muscle pain. But before we invite Dr. Yin to give a talk, I'd like to introduce a bit about the Head Foundation for those of you who are new. We are a nonprofit organization based in Singapore. Our mission is to improve lives or help to improve lives in Asia, especially in Southeast Asia, through education and healthcare. We support education and healthcare projects, try to bridge gaps in these two areas. And we are especially interested in supporting initiatives that bridge the East and West, right? We try to look for solutions, support solutions that have both the East and West elements, because we believe there are advantages from both the East and West approaches, and it will work best when they complement each other. For example, in healthcare, we know we are pretty much Western-dominated healthcare system. We have that in Singapore, but we also believe, many of us, we also use traditional medicines, traditional healthcare solution to complement the Western medicine in the mainstream healthcare. So our effort is to try to support the introduction of traditional medicine, especially TCM, traditional Chinese medicine, to introduce some good solutions into the mainstream healthcare so that the patients and the family have more options when it comes to medical and healthcare solution. At this point, I'd like to ask, how many of you have some kind of muscle pain or back pain? Okay. So I can share that, there was research that shows that at least 80 or even 90% of the adult population experience some kind of low back pain, for example, in their lifetime. And some of this can be quite serious to the extent that it affects your lifestyle, affects productivity in the workplaces. So just an example of the project or the research we support, right? We are currently running a clinical research to show the efficacy of traditional Chinese massage called Tuina in treating chronic lower back pain, right? In this project, we work with Mayo Clinic in the US, Singapore General Hospital in Singapore, and also a Chinese university called Jinan University in Guangzhou, China. So we try to run clinical studies in 3 places at the same time with more than 600 patients to compare traditional Chinese medicine and Western physiotherapy in treating lower back pain. The objective is to show systematically and scientifically that traditional medicine is as good as Western physiotherapy, right? Because we know in order to introduce traditional medicine into mainstream healthcare, you need to have clinical proof, right? So this is one example of what we do. And in the process, as we work with Mayo Clinic, we went to Mayo Clinic to run a workshop on Tuina. And when we were there, we met Professor Yin, or Dr. Yin. Okay, and she happened to be in Singapore this week. So we took the opportunity to invite her to come to our auditorium to share some of her research with us. Dr. Yin is a research scientist in radiology and MRI. And now, since all of you have experienced some kind of pain in your life, we know that pain is a very subjective thing, right? Because Usually when we do even clinical research, when you want to measure pain, there's no objective way to measure. Usually you ask the patient from a scale of 1 to 10, how painful you are, right? But that depends on many things, right? First of all, different people have different pain threshold, right? Some people can tolerate pain better, some cannot tolerate too much pain. And I was told yesterday by a doctor, there's even a racial parameter in this. You know, certain races in Singapore can tolerate pain better than other races. This is something new I heard, but I also heard from some doctors who participated in our research that the same patient may tell you different pain level depending on whether their spouses are around, right? If your wife is around, you probably feel more pain when you ask about the pain level. So it's very subjective until we heard something from Dr. Yin. Now she is doing something pretty state of the art. She's using a technique called MRE to measure pain objectively, right? So I'm not the expert. I'll leave it to her to tell you what MRE is and how the new findings in pain measurement is going to help us to manage pain and deal with pain better. Now, I just want to remind all of you that Dr. Yin is not a medical doctor. She is a PhD doctor. I saw a lot of you having questions of back pain and how to treat pain, but please reserve those questions for another speaker we have today. We also have Professor Linda Zhong from Nanyang Technological University. She's the director of Chinese Medicine Clinic. So she is going to share how pain management is done in traditional Chinese medicine, and she will have a dialogue with Dr. Yin so that we have a better understanding of how Western and traditional medicine can complement each other in pain management. So without further ado, Dr. Yin.
It's gone. Okay, great. You can hear me nice. So good evening, everyone, and thank you, the Mr. Liang Head Foundation for the invitation and for that warm introduction also. And my name is Ziying Yin, and I'm from Mayo Clinic. And today I'm thrilled to have this opportunity to introduce you a technology we have developed named MRI elastography, or MRE for short. And so in the next 30 minutes, as Mr. Liang just mentioned, I will walk you through like why we brought MRE into this and how it enables us to quantify, oh, I have my slides here, quantify the mobility of the myofascial interface and the muscle stiffness, and how discuss its great potential in evaluating the pain treatment efficacy. So I think when we look into the latest data, and there's about, when we talk about musculoskeletal disorders, it affects about 1.7 billion individuals all over the world. So the imaging here you are seeing is a age standardized map of the prevalence of MSK disorders as of 2020, with darker shades indicating a higher prevalence. So we are really looking at the global issues here. It affects almost every country to some degree. And within this wide spectrum of MSK disorders, the chronic low or the low back pain actually has been identified as an emerging concern, which affects almost would be in the top cause for the disability in up to 160 countries. So when we consider all the risk factors and all the conditions it can lead to the disability and quality of life, I think everyone in this room would agree with me that MSK pain isn't simple. It is really complicated and multifactorial. So what you're looking here is called a projection map that is pulled from a map model that lays out the variety of factors that could contribute into this. So what this imaging tells us is the community believes every single parameters could be relevant to a person with the low back pain. So with such a complicated system at play, so we at Mayo Clinic, we are trying to understand and measure the actual tissue damage, especially how it disrupts the mechanical integrity of the myofascial interface. So I'll explain to you more about that. So let's now narrow down to one of the pain conditions, that is the myofascial pain. It is a pain condition that can either be acute and more commonly seen in chronic conditions that involves the muscle and its surrounding connective tissues with the memorable palpable top band and active or latent trigger points, etc. And the connective tissue that is we call the fascia. And our understanding about this myofascial pain is very limited. And the prevalence data is ranging from 30 to 80%. And you see quite a variation of that range, and entirely based on the subjective evaluations. And because there's no objective biomarkers, so it's very challenging to evaluate if one treatment is effective or not. Of course, we can ask a patient, but it's, as we just mentioned, it's quite subjective. So with that in mind, and technically speaking, there's none of the treatment that have been fully quantitatively tested in the clinical trials. So then where do we start? So it's from the clinical observations, we know that the affected regions can often be physically palpated under pressure, and patients are often feeling kind of a locked motion with experience a reduced range of motion. So we know that the obvious tissue that involved into this is the muscle itself for sure, but the muscle do not function in isolation, but rather they are surrounded by layers of connective tissue called the fascia. And this is what we are looking at. The muscle and fascia are working together as a cohesive unit to support proper function. And the healthy fascia, that in its healthy state, it will transmit the force generated during the movement and also allow a smooth gliding surface between the muscles when we do the movement. So you can actually freely move your body aloud. But this is mainly because of its, according to a lot of research in animal studies and also human studies, this is because of the natural elasticity of the myofascial tissue itself, and also the lubricating effects from that, what they call the hyaluronic acid. I hope my laser point is working. Okay, it's not. So the hyaluronic, sorry, I'm going to use the pointer here. So hyaluronic acid that is abundant in this kind of loose connective tissue of the fascia system. So what it happens is that there's a theory of the myofascial pain is when with the misuse or overuse of those muscle. For example, someone with a desk job sitting in front of a computer for quite a long time with a poor posture, or someone who pretty much works throughout the weekdays, but during the weekend they have a burst of activities, then they have some recurring pain after that. Those patterns of overuse or misuse could disrupt the integrity of this fascia system. So the myofascial kind of hyaluronic acid will become denser and more viscous, and so it's less efficient in transfer the motion. And what it does is it also in turn like inhibit the proper output function of the sensory nerve set inside of this structure. And over time, it will lead to the microinjury, chronic inflammation, scarring, and adhesion. So the fascial layers, they're not smoothly gliding anymore, but rather they are more viscous and adherent. And which in turn will lead to the locked motion, rigid, tight muscle, maybe the pain and the muscle dysfunction. So when a patient comes to the clinic with a myofascial pain, and we, of course, after ruling out the most severe problem with the disc issues, the physiological concerns, and the predominant techniques that we would offer to those patients is typically all various forms of what they call force-based manipulation, FBM, which is a term that is just to be used by the US National Institute of Health, NIH. the manual procedure involves a lot of different techniques, and with the purpose of reducing the tension and improving the range of motion. And what you're seeing here is the number of publications that focus on this force-based manipulation, FBM, indexed by the PubMed. In blue is the number of publications, and in pink, all the studies involved in the randomized clinical trials. So you can see there's about 250, in order of 250 clinical trials are doing annually in this domain. And on the right, you see the NIH funding that in this research, in this domain as well. The blue bars are the individual number of projects that are being funded by the NIH to study this force-based manipulation, manual therapy. And the blue lines are kind of total funding that is provided by the NIH. So you can clearly see that there's a steady increase in the interest and funding levels from the NIH that to support this program. People are really interested in this. So I'm going to use this as an example. This is a research network that is initiated by the NIH, National Center for Complementary and Integrative Health, NCCIH. And they involve a lot of studies understanding the mechanisms, efficacies, and efficiencies of the clinical manual therapy of the treatment. And their goal is trying to bridge the gaps between the neuroscience, bioengineering, manual therapy. And I'm fortunately going to give a short talk to them about their annual workshop late this year, and to introduce again our techniques and also discuss with all the other network members about the force-based manipulation. So it is a great example showing how they actually start to picking this up and learning from each other to solve this, to understand this thing. So as defined by NIH, the force-based manipulation involves any kind of techniques that involve light touch, pressure, mobilization, thrust, adjustment, and needling. And which of course, including Tuina, as Ms. Liang just mentioned, it is one of the oldest form of manual therapy from traditional Chinese medicine. My study also involving the Tuina as well, and I will come into that at later slides. So now let's I think one thing is quite clear so far is muscle palpation and force-based treatments, they are helpful, as evidenced by over 2,000 years of use, almost pretty much throughout the world. Everyone is using it. But there really is a kind of a biggest challenge or missed opportunities when you talk to the people or the Western community, like there's not enough scientific data literally to support or to demonstrate see the difference and it's useful. I think it's very challenging to do so, just simply because we don't have an objective way to study this. So, of course, from an imaging point of view, I know there's also other ways to prove that that traditional Chinese medicine is useful, but I'm purely from the imaging perspective. And so where do we start then? What kind of measurements we really want to develop? So whether it involves muscle palpation or the force-based manipulation, I think practitioners, they all apply two kinds of forces, the compression force and shear forces. That means they push tissue down and slide it laterally. And depending on whether it's for the treatment or for the diagnosis, they will use various levels of forces or different techniques. But what they have in common is that they evaluate the tissue stiffness by assessing how much force they needed to deform that tissue. And they assess the kind of the tissue plane mobility by assessing how easy they're able to glide this tissue against the layer tissues. So what we really need are non-invasive imaging ways to actually measure, quantitatively measure the mobility of fascial plane as well as the muscle stiffness. And it has to be non-invasive because we want to do it in a longitudinal study. We want to measure it over time, kind of several times, so we can trace the nature history. We can correlate the tissue level measurements with the symptoms, and we want to evaluate if a patient is how his response or her response to the treatment. So the MR elastography or MRE is really the ideal tool because it essentially is the palpation by imaging. Why is that? So MRE is MRI-based imaging technique. You know, MRI, that kind of round, big, loud machine. And it really enables the visualization of the internal, the wave propagation, mechanical properties inside of the body. And since its first publication in 1995 in Science, and MRE has been have seen its application broaden significantly across various organs and tissues. You can almost across the whole bodies, we can do the MRE. And the current main application is on the liver side. It's assessing the liver fibrosis. It has been considered the gold standard. Now the patient at Mayo Clinic, they're rarely to do the biopsy for the liver fibrosis, and MRE is the gold standard. And it has been FDA cleared since 2009 and has issued a CPT code for the reimbursement, which means the physician can order a scan and the patient can bill to the patient can get reimbursement after that. And it also is a standardized technology across all the MRI platforms, no matter it's GE, Siemens, or Philips scanners, we are able to do that. Well, here's a quick rundown on how MRE works. So the MRE is based on the idea that first, you put the mechanical waves in, you vibrate these tissues, and second, you use a specialized imaging method to image it, to get an image. And finally, depending on what parameters you are interested, you can use algorithms to calculate the elasticity, like how stiff the tissue, viscosity, how viscous your tissue is, the shear strength, how the deformation of your tissue, and shear plane mobility, and etc. And all those results are immediately right after scan, show right after the scanner. And I'm going to just show you two examples that's most popular in the world of MRE, that is liver and brain MRE. So as I mentioned, MRE requires a vibration source, which sits outside of scanner, sends gentle vibrations through that long tube to the tissue regions that you are interested. And depending on different kind of regions, of course, you apply the different drivers. For example, a pad driver for the liver and the pillow, soft pillow-like driver for the head. So reminds you, the vibration we applied are very small. That is its amplitude is range of micrometers. It's definitely not a strong vibration. It's very minor vibration. So, and similar to the muscle, when we want to use MRE to evaluate the muscle, then depending on which muscle that we're studying, we need a specialized driver. And over the years, we at Mayo Clinic and also other research groups developed a variety type of driver for the lower extremities and the lower body, lower back. And so what you're seeing here are those grayscale are MRI images showing the static view of the internal structure of the human body. And those blue and red images we call wave images. It's like when you throw a stone into a pond and you see kind of a water waves going on. That's what exactly is this wave, how the wave propagating. By looking at this, we are able to tell the mechanical properties of the tissue. And now let's circle back to this myofascial interface again. So as I mentioned, that healthy myofascial interface, they're freely can glide smoothly against each other, but the impaired interface, they might appear stuck and have a limited mobility. So the key here is really, do we have an imaging method to see that separation or to see that motion reference? So think about under the force. If the two layers, they're not adherent, that they will they will slide each other, they freely slide over each other. And if they're adherent, that they will stuck together, and we call it has an adherent interface. So it's purely like when you try to separate bread layers with from a sticky cheeseburger or a clean egg burger, it's the force required is different. So the physics is right there. And with MRE, and we apply the vibrations to the tissue is passively vibrated by the MRE vibration. So when the when they're in the regions that two layers, they're not adherent, we call slip interface, there typically has a large shear strength happening, large deformation happening over there. But if the two layers, they are adherent and stuck and move together, the shear strength, the shear deformation is much less. And this variation of shear strength is exactly what we are measuring using our MRE-based technique we call slip interface imaging, SII. And originally, SII was developed to assess the brain tumor adherence in preparation for the tumor kind of a surgery. And for the examples I'm showing here is the one type of brain tumor called meningiomas, which is the most common type of a tumor, brain tumor, intracranial tumors. And for those patients, the treatment is typically the surgical removal. But in order to do the surgical removal, you can literally imagine that if one tumor is adherent to the surrounding brain structure, it will be really challenging to remove that. But if the tumor is separately from the surrounding brain, that would be relatively easier. So what we are seeing, the tumor on the left, we see this bright kind of contours around this tumor interface. And that is the corresponding to the high shear strength, which means the tumor is separate from the surrounding brain. So this tumor is relatively easier to be surgically removed. And the tumor on the right is no such a bright contour, so we know it's likely to be adherent and it will be quite challenging and difficult to remove it. And for the surgical confirmation, actually it is the case. Yeah, it's just showing we have a way to do the 3D visualization, which is good. And funded by the NIH HEAL initiative, this is a program that sponsors a lot of projects to develop quantitative imaging biomarkers to study the myofascial tissue and myofascial pain. And our study is funded by them as well. We apply this SII to assess the myofascial interfaces. So our first exploration actually starts from the forearm. We want to see the functional myofascial interface of the FDP muscle, the flexor detorium profundus, which is the forearm muscle. So this muscle is quite specific, is because it allows each fingers to move independently, or like doing the independent motion through those finger specific tendon attached to this muscle. But it in the muscle itself, in the muscle itself, you don't really see a separation for the different compartments controlling for the different kind of finger function. Here, what you are seeing is the anatomical MRI, the cross section of the forearm, and the dotted lines circulate the FDP muscles. You see the separations, the outside of the muscles, you see I wish it's working, but now, okay. On the outside of that dotted line, you see the separation between all different muscles, but within that muscle, you see it's purely a whole black. You don't know separations. Here's when it gets interesting. And when we apply the vibrations to each finger individually, and a particular part within this muscle is lighting up by that bright contour. And when we move to the middle finger, a different part is highlighted. And so goes with the ring finger and little finger. So you see that with different finger movements and your particular part of within this muscle itself is highlighted. That is the functional compartment of this muscle. So you can see that if you can imagine when you have a properties in kind of moving this, there will be that interface actually highlighted. So as long as there's a relative motion between the different muscles, we have the ability to move the muscle, we are able to see that. And when we move to the side, we are looking at the deep intervascular fascia, which separates all the kind of muscle compartments for the upper leg. And we developed this tube driver wrap around the mid-thigh to introduce vibrations. And on the top right is a shear strain map again with the bright contours. You see the separations between, that's from healthy volunteer. You see the separations between different muscle compartments, means the muscle has the ability to move, except for the VL and VI muscle. You see the VL muscle from anatomical MRI, you see how a nice kind of separation, but not from the shear strain map. So why is this case? This is a healthy volunteer, so we should have the excellent mobility without any restrictions. And later on, we find that is because of the body posture. And if it really affects our visualization of interface. When we ask our volunteers to straighten the leg, so their thigh muscles were not passively stretched by this bending the knee, and we are able to see that interface again. So this is just showing that how sensitive our technique is. We are able to see that dynamic changes of the myofascial interface across the different muscular conditions. Where am I right now? Yeah. So now when we focus on back to the low back, we have a clinical studies going on. So we are interested in the intermuscular myofascial interface, as well as with the thoracolumbar fascia, that TLF, for patients with and without chronic low back pain. And that TLF fascia is the largest fascia in the lower back, and it contains multiple layers with the posterior, middle, and anterior layers. And together with the muscle that they encapsulated in between, like the erector spinae and the erector spinae here and the condratus lumbar over there. And they together, they help to maintain the proper body posture and facilitate the kind of a range of motion. So disruption to this system would definitely reduce the range of motion and leading to the pain possibly. Good. And it's not working again. Yeah. So imaging actually is to visualizing this it's actually very challenging. It's a lot of stories behind things. We tried a variety of versions, tries and errors. We are successfully to do so. I know without kind of a training, it's hard to tell, but we are actually able to see those kind of interface for almost every single myofascial layer successfully. So this is very challenging to do. And what's really exciting is when we look at the comparison between the healthy and patient. For example, this is a healthy volunteer. Before imaging is from our axial view like this. And now if we turn back to the coronal view or the section view or a sagittal view, we're able to see a better separation between, let's say, the ES and M muscles and the QR and ES muscles. For these healthy volunteers, you can easily trace down that kind of high intensity, bright lines between the ES and M and Q and S kind of contours, the intersections. So what about the patient? We scan patients with chronic low back pain. They suffer from that for quite a long time with the severe, moderate to severe pain levels. And this is again the coronal and the sagittal view of the patient. And the patient actually lost that kind of mobility in some of the conjunctions of the ES and M muscles and QR and ES muscles. And we see again the same thing for the other patients as well. It's kind of consistently, we observe that. This is very exciting because this is literally the first time that we are able to see that myofascial interface in a 3D view doing on a healthy volunteer patient and see the difference there. So that could indicate, that suggests our technique has a great potential in doing so. And when we quantify this, we develop an index called mobility index that with a high values, we say there's a large freedom to motion, low index, we have restricted mobility. And as expected, the patient in general has a reduced mobility than the healthy volunteers. So we're okay. Yeah, I don't forget about muscle stiffness. And for the muscle stiffness, we are also able to do that. What you are seeing are the wave images that actually with the zero load from the bicep muscles with zero load and with load of 4 kilograms. And you see the increased wavelengths. By wavelengths, we actually mean the width between like those kind of yellow and blue lines. This means increased stiffness. So we are not only able to measure stiffness, but also able to track its changes over different loading. And this is another studies that I run out of time, so I can go fast. This is another study that compared in the kind of muscle at the rest and during the contraction. And the imaging, the color imaging you see, we call it elastogram. That's a stiffness map. That is the quantitative map that tells you which part of your body is getting stiffer, which not. So it's a measurement. We see a clearly increased stiffness during the contraction and compared to the rest. What about myofascial top bands? So we know that this is something physically palpable, and this is exactly what our MRE measures. So on the left side is the trapezius muscle of the healthy volunteer, and the imaging next to it is the patient with a clinically documented top bands, and we see an increased localized stiffness in that region. And there's another imaging showing, highlighting, supporting this findings as well. So, okay. So with all those kind of unique adventures or benefits offered by the MRE, which is non-invasive, quantitative, objective, and very highly sensitive, and our goal is trying to develop non-imaging based biomarkers to facilitate both the diagnosis and the long-term longitudinal treatment monitoring. And we're currently in the middle of testing its repeatability and doing a clinical validation. And the really exciting opportunity is the clinical intervention study that we will do starting from next year, which is funded by the NIH. We will study those kind of changes of the myofascial interface mobility and muscle stiffness before and after TUINA treatment. And we choose TUINA is because we think it's really suitable. It blends action of TUI, that is pushing, and action of NA, that is squeezing and lifting. So you can, from the name, you can tell that it actually is helpful in release the muscle tension and the myofascial adhesion. And surprisingly, and at Mayo Clinic, we're well equipped to do this kind of intervention. Thanks for the team from Dr. Brent Bauer, who is my clinical partner, and with the generous support from Head Foundation, and Dr. Bauer and his team has built a successful collaboration with the two other great facilities, centers, Jinan University and Singapore General Hospital, to conduct this clinical trial that Mr. Liang just introduced. What's really good about this study is that it builds a standardized protocol to integrate this traditional Chinese medicine into the modern practice of the Mayo Clinic. Which means that for me, if I'm NIH study, NIH funded research, if I want to use TUINA in my study, that is feasible. Without this kind of a study, I'm not able to adapt that into my study as well. So it's very useful. And another highlight is of course the EMMA. This is the expert massage manipulation automation by Altreat, and developed by Albert and his team, and they are really focusing on standardization and improve the standardization and the effectiveness of this TUINA treatment. And we at Mayo Clinic fortunate to have their latest version of the almost latest version of the EMMA, and we did a pilot study, and all the volunteers reported extremely positive feedback. So showing that it's great potential. So hopefully we can, in the future, we're able to include that into our study as well. So this is my last slide. I know most of you probably come here to hear the treatment, but unfortunately we're not that yet. I apologize, but trust us. So I want to focus on this imaging again, is because you see a quite difference between the patient and healthy volunteer. So wouldn't it be wonderful if after the treatment, that lagged interface will be showing up again? That is a proof saying our treatment is effective. A patient, not only they're feeling, okay, my pain is lessened, I feel better, but we literally, physically, objectively, we see something is restored back again. So stay tuned. Apologize again, I don't have any treatment strategies, but stay tuned because I think we are developing something really, really useful. And last, I have to acknowledge my grant and my NIH fund, they support this study, and Dr. Richard Eman, and he's the inventor of MRE, and he governs all MRE research in Mayo Clinic, and my own team, and especially Amy Hojo, who is in the audience as well, who did a lot of work on this, Dr. Brent Bauer and his team, and especially thank you very much for your attention. I hope that my talk can be something informatic to you. So let you know there's one technique here. We are not giving up. We are trying our best to quantify this to help everyone at Mayo Clinic. Thank you very much.
Thank you, Dr. Yin. If I understood Dr. Yin's presentation correctly, she's telling us now we don't only feel pain, we can also see the pain. And by being able to see the pain and, because of the resolution and the sensitivity, we can measure pain more objectively. Yeah, instead of, in the past, pain is something subjective. Yeah, so again, in the spirit of East and West, we heard of, something new from the Western medicine, or maybe it shouldn't be classified as Western medicine. It's probably more of physics, right? Which is no East and West, okay? But let's invite Professor Linda Zhong from Nanyang Technological University. Some of you might have seen her on TV with the minister before. So she's going to talk a little bit about managing pain and how the new technology Dr. Yin just talked about can potentially be used in managing pain, measuring pain, so that we can find the optimum solution, by combining Western technology and traditional medicine in managing all kinds of pain associated with our muscles. Thank you.
Hello. So actually, I'm also not an expert in pain management. My major is actually digestive disorders. So today, I just want to give you a very broad introduction of Chinese medicine's perspective on pain management, and also maybe introduce a little bit about the current situation in Singapore about like chronic pain management. So of course, we know Singapore is Western medicine is the mainstream of our health system, right? But actually, we also have complementary and alternative medicine. According to a survey conducted by MOH, actually, most of the participants or most of the patients, they use complementary and alternative medicine within 12 years, within 12 months, like 76%. And of course, the female will use much more than male. I think maybe they more care about their health and their family. So that's why they will try to find as much as possible to help their health and also their family or their kids. But what about the categories of complementary and alternative medicine? We also have different ethnicities in Singapore, not only Chinese, right, but also Malay and Indian. So actually, according to the survey, 84% of the Chinese people will use complementary alternative medicine, and 69% Malay people use, and 69% Indian people. So I think it's very normal and very common among all the Singaporeans to use complementary and alternative medicine. But among all these complementary and alternative medicine, actually, Chinese medicine, we call it traditional Chinese medicine. But actually, it's not so traditional. It's Chinese medicine as the dominant approach among all the complementary and alternative medicine. So we can see from this figure that actually 88% of the complementary and alternative medicine in Singapore is Chinese medicine. So I think we have another Malay medicine and Ayo medicine is from Indian. So we all compromise the complementary and alternative medicine in Singapore. So of course, this is the percentage of the use of Chinese medicine in Singapore. And the Chinese medicine is quite broad definition. Later, I will touch a little bit about different approach like acupuncture, acupressure, cupping, herbal medicine, food, Chinese food therapy. So all this can be categorized into Chinese medicine. So the use of complementary and alternative medicine, actually we use mainly as about traditional Chinese medicine. and also Malay traditional medicine and India traditional medicine, and all these are the others. So we can see from this picture, for the use of complementary and alternative medicine for the chronic pain in Singapore is actually they have mainly three different types. First is the neck pain. I think it's quite common, especially our young generation, especially our all these electronic devices. So we will use a TCM, and people will use ginseng. Very strange. They use ginseng to treat neck pain. Later, I will touch a little bit about how Chinese medicine view on chronic pain, and also vitamins, and also chiropractors. Chiropractor is also very common in Singapore, I think. And upper limb pain, we use Chinese medicine as Tui Na. Tui Na is quite common and a little bit different from massage. Because Tui Na, as Dr. Ying also mentioned, that Tui Na will use different types like pitching, switching, and also we use the pushing. So the point, acupoint is also very important. So we will not only use the muscle trigger point, we will also focus on the acupoints, which is quite unique for Chinese medicine. And abdominal pain, of course, I think abdominal pain is a different type of pain because it's a visceral pain. It's not the muscle or the joint pain. So actually, Tui Na or other like external treatment may not have very good effectiveness. So actually we will use herbal medicine. But herbal medicine is quite complicated. So today I will not mention too much because in Chinese medicine, we'll focus on pattern diagnosis, which is the diagnosis is according to your symptoms, your pulse, your time. So it's a holistic approach to diagnose you as certain kind of pattern. So based on that pattern, we will use the combination of different herbs. So it's very complicated. So you have to see a Chinese medicine doctor, and they will give you four, like we have the looking and pulsing and also questioning and also all this holistic approach to give you a very comprehensive and precision diagnosis. So of course, I think as CD also mentioned that currently in Singapore, we also lack of the the bridging between the East and West. So currently the main problem is the communication of TCM use in our Western medicine consultations, right? Because actually more than half of the patients will not tell their doctor that they have already seek the consultation of the Chinese medicine, or they tried already like Tui Na or acupuncture, because they are afraid that maybe the doctor will have another view on their treatment or something like that, or maybe they are concerned about the herbal drug interaction. So I think evidence is very important, and also evaluation is very important. That's why I think we can use the scientific approach and also the bioengineering or bioelectronic approach to help the Chinese medicine will have a more evidence-based, and also we can explain to the doctor how it works. So I think that's very important because it's also really existed the communication barriers between Chinese medicine practitioner and the physicians, right? So this is a very broad introduction about how Chinese medicines view on pain. Of course, it's quite subjective. The pain is quite subjective, but it really affect your quality of life, even affect the chronic disease, another chronic disease, the progression. So in Chinese medicine's view, actually, they have very clear two factors. The first one is the pain is due to the deficiency of weakness. So which is quite, I think it's just correlated with our aging population nowadays. So because you are lack of the qi and blood in Chinese medicine, maybe it's because of the weakness of your muscle, and also like sarcopenia is very common among all our old generation, and also osteoporosis. So all this is related to the deficiency and weakness. Another main factor is external factors. We call it like maybe you have inflammation, maybe you have different infections, or you have internal blockage. For example, you have plaque stasis, you have stagnation and fracture or neuropathy pain. So all this is related to the external factors. So I think it's quite easy to understand. It's from your deficiency and from your like sufficient. It's too much, maybe as the external factors. So this is the main approach for Chinese medicine to treat the like a pain. First, of course, is the most complicated is herbal medicine. But currently, herbal medicine can also be manufactured as the patent medicine. Like you can take it by like capsule, pills, granules, very easy to adapt it. Not only the decoction, the very bitter soup you maybe think about it. Actually, currently we will use the capsule and also the granules to treat the chronic pain. And also acupuncture. Acupuncture also have different types. The first one is electronic acupuncture, which is quite standardized and also can be applied in research. So we will use different electronic stimulation and stick it to the needlings, and we can adjust their waves, their frequencies. So it's quite standardized. You can do research based on all these index. And trainer, as mentioned, actually, I think we have a very good tool as robotic trainer, because you know, trainer is quite individual, and different practitioners, they have their own styles of we call it manipulation approach. And also it's not so stable, because you will feel very tired if you do like continuously 30 minutes, because per session, usually the treatment per session is 30 minutes. But if even you are very experienced trainer therapist, actually you will feel very tired, and maybe you are not so stable, especially at the last maybe 10 minutes. So I think which will also affect the effectiveness of the trainers like approach. So I think robotic is a trend, because nowadays all these things can be evaluated very objectives, and also currently we can use different tools to assess, to evaluate, and also know the mechanism inside. So I just give you a whole picture of how we use the different approach to handle the pain management. Of course, I would also, because I think we are all Chinese culture, and also we have affected by Chinese culture. So actually we would like to use the food as one of the therapy, because you know, in Chinese medicine, some of the food can be treated as medicine. We call it in Mandarin, called 药食同源. The food and the medicine are the same rooted. So actually we will use the meditated diet. But meditated diet is not so popular, I think, currently in Singapore, because I talked to my colleagues and they seldom cook by themselves. So actually we will use like a different natural products, like ginseng is quite popular, right? And also Chinese yen, and Chinese yen can be cooked soup, and also it can be like manufactured as powder and put in like different kind of drinkings. So it's Chinese yen. And also wolberry, I think it's very common. People use it like tea, right? We can drink every day without any severe side effects. And also the milkweed root in Chinese is huangqi. Huangqi is also a very good and also very safe ingredients for improve your energy, and also the antioxidant effects. So all these things can be used very safely. Of course, they can also harmonize the qi and blood and balance the yin and yang. But qi, blood, yin and yang, they are very Chinese medicine concept. So I will not mention too much today because, you know, if mentioned, it's like a course to teach how to use Chinese medicine theory. So yeah, of course, I think a lot of research also conducted on Chinese medicine exercise, like Qigong, like Tai Chi. Of course, we have a very good 八段锦. I think Singapore also currently in community center, people would like to teach you how to do 八段锦 because it's very simple and also easy to memorize. Because Tai Chi is very difficult. You have to remember maybe at least 24 styles so that you can, you have the movement. But 八段锦 is very easy, very simple. It's only have 8 styles. And also they can exercise each body joint, muscles, and also strengthen your muscle and also to release the stiffness. So 八段锦 currently, we have a lot of research and even they have apps. In Shanghai, they have apps to capture your posture to see whether you have enough position and to evaluate which you are right. You can just do it at home. So I think 八段锦 is a very good exercise for the muscle pain and also for the joint pain, chronic pain. Of course, a 内功 is something like qigong. You have to do the breath exercise. So you have to like follow a master to practice. It's a little bit difficult, but I think it's also help you to improve your energy and circulation. So, okay, so I just give you a brief introduction because I think I'm also not familiar with the very specific scientific aspect because my major is digestive disorders. Thank you.
Thank you, Prof. Zhong. Can you please stay and I invite Dr. Yin to also come to the front for the Q&A session, and maybe we can also have a bit of discussion. Maybe the two of you sit on the other side.
Sure, I'll just do this side.
Well, while we are collecting the questions from the audience and also from online, there are two things I'd like to share because you may not everyone may know this. Mayo Clinic is the #1 hospital in the world, in case you don't know. Okay, that's where Dr. Yin is from. And our Singapore General Hospital used to be #3 in the world a few years ago. Okay, now the position has dropped. I don't know what it is now, but we also have very good hospital by world ranking. Top 10, okay. And the other thing is about acceptance of traditional Chinese medicine in the mainstream healthcare system. You may know you can get acupuncture treatment in many Western hospital systems today, including Mayo Clinic and Singapore General Hospital. And to get Western hospital and medical healthcare system to accept acupuncture, it took more than 10 years of efforts by a lot of researchers and practitioners before FDA gave approval to provide acupuncture treatment in hospitals and public healthcare system. And that is used mainly in pain management. That's my understanding. And what we are trying to do now is to do the same for Tui Na as acupuncture, right? We want to introduce Tui Na, scientifically prove Tui Na is effective in managing pain. And hopefully it wouldn't take more than 10 years, right, to introduce Tui Na into the mainstream healthcare system. So with the help of Mayo Clinic, with the help of Nanyang Technological University, Prof. Zhong. So this is what in HIT Foundation, one of the things we are trying to do, right? So that you have another option, you know, when you have muscle pain, chronic lower back pain, especially when we have quickly aging population, right? We see a lot of chronic pains among our population, and even the younger people, they have back pain, shoulder pain. So we need better ways to measure, to treat some of these pains, right? To improve our quality of life and productivity. Do you have anything to add before I get to the question? Or anybody from the audience, if any question, please raise your hand. My colleague will pass the mic to you. Yes, this gentleman here.
Thank you for the presentation, Dr. Yin. I was just asking a basic question. You said when you apply a shear force, your muscles slide over each other. There's an interface with a connective tissue. Does it matter the connective tissue changes, the type of connective tissue? So what type of connective, areola, reticular, even adipose tissue is also connective tissue. So loose connective tissue. So which type of tissue, connective tissue helps these two layers to slide?
2 layers slide.
Yeah. The second
Yes.
question is that the amount of hyaluronic acid, does it play any role in the, say, sliding? If the content of hyaluronic acid increases, then does the sliding force increases? So is there any connection to that?
I see.
Yeah.
Yeah, I have a mic on. Right, great. So that's a great 2 questions, actually. Thank you for the question. And to answer your first question, the first question is trying to see that what type of a connective tissue I'm referring to. And I think for a current study, we are referring to the intermuscular, which means the muscle, more like the muscle, first of all, the fascia layer is a very broad term. It covers your internal organ. The out layer is the mouth, is a fascial layer, and your cartilage, the over the nerve, it's a fascial layer. We're looking at the myofascial layer, which is outside the muscle belly. Yeah. So also the inside, there's a small muscular, small kind of muscular, fibers within the muscle belly itself. It also has those kind of little small myofascial layers. We're looking at the outer one, the 2 muscle groups moving. That's the regions we're more interested. For example, in the low back, we are looking at the separations between the, let's say the QL, the quadratus lumborum muscle, or the QNES, the erector spinae, or the erector spinae with the multifidus, and those kind of relative motion. So in terms of second question that you were asking, is there any correlation between the hyaluronic acid content with the mobility, right? So there's the animal studies clearly show that under stress, which means if there's a lot of overuse, the hyaluronic acid, the healthy hyaluronic acid is a long chain. So long chain means their molecular form is kind of long chain. But after stress, it will decompose into the shorter chains. It's just the way how body reacts to it. So with that, and it will entangle together and become a larger accumulated together. Rather, it's not kind of being more lubricating, but rather it become more viscous and sticky and like it's gluing together, if we understand. So it's not like the more the better. It's always also with their molecular weight, they become smaller molecule, more viscous, more entangled, so on. So I hope I answered your questions. Yeah.
Yeah, one more question.
Let's give other a chance. You can come back later. That gentleman, yeah.
What do you think of the EMS technology, electromuscle stimulation? I find it very powerful to help in my pain management, especially lower back, knee pain, back pain, whatever pain, very powerful. Is it true?
So again, I have to say that I'm not a clinician, but I do know that because we at Hill community, a lot of research going on, we do see that is improving pain and improving the treatment. But in terms of the real more kind of standardized or professional environment, I will refer to Professor Zhong if you know anything about the ECM or.
I think currently we will use kind of electronic stimulation for the muscles. I think it works for most of the patient. But of course, some may have different factors. So I can say most of the patients will benefit, yeah, from the electronic stimulation. Yeah.
Thank you.
Okay, before we get the next question, I'd also like to add, I know there are some doctors in the audience, both traditional Chinese medicine practitioner as well as Western doctor. So if you know the answers to some of these questions, please feel free to help answer. Yep. Yes, the gentleman.
A question for the second speaker. So regarding the exercises that you mentioned the last slide, any like good recommendation of where, like which center in Singapore to like attend?
As I know, they have a very, they have very Western Eastern combination center, and also they have like exercise like daycare center to teach the elderly to do the exercise, 八段锦, and also like Tai Chi. Currently, we will collaborate with a national health group in Woodland. We will have a community service learning for our students to teach the elderly population to do the exercise. But I think it's not yet initiated, but it will it begins soon. Yeah.
Kathleen has a question.
I have a question, but I also like to answer the questions of where to find the center. The MR Twin now is in Parkway Shenton in Harbourfront. There is a Western clinic there, and next to it is a TCM clinic. If you want to visit, you can go to Harbourfront Tower 1. For the questions I have is, one is about the Chinese medicine, the traditional Chinese medicine herbal medication. We understand that Western medicine, a lot of people are fearful because of the liver. Sometimes we get side effect from the Western medicine. How about Chinese medicine or herbal? How much you think it may be excessive? For example, usually when kids have fever, we say you drink 3 times of Yang every 4 hours, something like that. So how it will affect the liver?
Yeah, actually, this is a very important question because I think every time people are concerned about like the side effects of not only a Chinese medicine, but also all the approach. Our observation that if we use individualized Chinese herbal medicine, that means the Chinese medicine practitioner will prescribe like 1 week of decoction or granules, or according to your current conditions. Then it's a combination of different herbs that they will consider the balance between like very strong like action herbs, and they will also add on some herbs which will protect your digestive system. So that will not have a very severe side effect. But of course, you have to adjust your prescription every 1 or 2 weeks according to your conditions. Because when you take the medicine, herbal medicine, you will have improved or you will have a different response, so that you cannot continuously have one certain types of prescription more than 1 month, which is not suggest. Because, each herbs, even they are very mild, they also have side effects. So for example, berberine, right? It's a very good herbal medicine, but it's also, if you take it long time, it will also have side effect. So we have to adjust the formula, the combination according to the response of the patient and also the patient's condition. Yeah. So I think a very experienced Chinese medicine practitioner, and you to see them every 1 or 2 weeks, it will not have severe side effects, especially liver and the renal function. Yeah.
Any question from this side? No. We still have time. Don't worry.
Okay. My name is Michael. I'm actually have operated on my head on brain tumor. Okay. And I survived 35 years till now. Okay. I also use TCM, acupuncture, and Trina, which is good. My question is that where do we find quality of, because there are so many in Singapore, what is everybody seems to be good. So when I search for neurosurgeon in Singapore, I actually search very analytically to find out how, let's say 10 patients, how many make it, how that, and how they do it, how you open my head or whatever. So now I'm actually asking a question, where to be integrate with your Mayo Clinic or the HGH or whatever. So we have more detail on qualitative treatment. I actually have a plan of health management on mental, physical, Chinese medicine to manage my life. I'm not young, actually, I'm 66 already. You see. Thank you, sir.
Who wants to answer this question?
I think it's not depend on us. It's depend on the government, because I think I understand that it's quite difficult to find so-called qualified. So how to assess the qualified TCM practitioner? Because in Singapore, actually, all the Chinese medicine practitioners are authorized by TCM board, Chinese Medicine Practitioners Board. It's like quite standardized, and also you have to obtain certain kind of degree and also like diploma so that you can be certified as a Chinese medicine practitioner. But I know your concern is how to find the different areas, like specific in brain tumor or specific in infertility. So that kind of things actually is, I think, is under consideration by the government, because government also noticed that they maybe would find some accreditation to different levels, like primary care, or maybe a little bit focus disease groups. But we cannot say how long or how to solve this problem currently.
Yeah, maybe I'd like to add a little bit to Prof. Zhong's answer. We, as in Head Foundation, we are also trying very hard to think about what is the next step after supporting clinical research, right? How to make the treatment or the procedure available, accessible, and also affordable to many people, and maybe not just in Singapore, right? In the rest of the Southeast Asian country, in the Asian country, and sometimes we call this capacity building, right? How do you train enough practitioners? How do you use technology to help to lower the treatment cost, right? So that is why we are working with partners in the US, for example, Mayo Clinic, and also hospitals in China to look at best practices and how we can work together to come up with a better solution. You may like to know, Mayo Clinic has a department called Integrative Medicine Department, right? They really try to integrate all kinds of Western treatments as well as traditional, not just traditional Chinese. There are all kinds of traditional medicine from different culture. So Mayo Clinic has a very big department under Dr. Brent Bauer, to look at how we can combine different types of treatment to provide better healthcare. So hopefully, by learning from each other, by having better regulated practices in Singapore, we can support more of this initiative. Let me take a question from the online audience. Okay, I hope I can pronounce these medical terms correctly. This is probably for Dr. Yin.
Yes.
I was this member from the audience said that I was diagnosed with myofascial pain syndrome with cervicogenic dizziness.
Wow.
Based on my MRI, I have cervical and lumbar radiculopathy, and I'm having my therapy with traction. TCM is also helpful, especially acupuncture. But how to relieve the nerve pain?
Wow. Again, that's a tough, okay, my mic is on. So I think that's a tough question for me, how to relieve the nerve pain. And the understanding how pain and how it regulates through the neural kind of neurological system is very challenging. And I think there's a lot of work research going on. I cannot really speak for the practice clinical again, that I'm not part of it, but I really want to share a new kind of research findings that really exciting from the a conference that I recently attended. There's the HEAL initiative who sponsor my research, has an annual kind of meeting conducted like annually to share all the latest findings from all the research across the US and maybe even the internationally. And they have an ultrasound focused deep brain stimulation. They are effectively reduce the pain. And because it's deep brain stimulation, so you would think it's kind of suppress where the sensory nerves, they kind of sense that pain. They're effectively reduce that pain and in a patient. And I think they're currently trying to do in the clinical trials, and maybe the next step is FDA approval because it's so dramatically improved. So at least there's some very effective research tools that I can speak of that. Apologize for not for the clinical practice. That is the one way that the people are doing. Yeah.
Thank you, Dr. Yin. Prof. Zhong, do you have anything to add from the TCM perspective on nerve pain?
Yeah, just as I mentioned that acupuncture, of course, is an option. But I think if you really want to improve the holistic situation of your body, maybe you can also try some herbal medicine and also maybe acupressure. And I think for the neuropathy pain, another approach is like head needling or ear needling. Because currently also a lot of research, they found that actually the gut and the brain and also the ear, the autonomous system is quite related to the neuronic pain. So actually, I think from perspective of Chinese medicine, maybe you can do different approach to treat, so that maybe you can find a suitable individual treatment plan for your condition. Yeah.
Thank you, Prof. Zhong. Okay, I take another question from online in the audience. This is a forward-looking question. The question is, what is the future of trainer in today's rising age of artificial intelligence? Dr. Yin, no, Professor Zhong may want to answer this question, but I know somebody in the audience who can answer this question. Albert, you want to try?
Thanks for the question. So give me an opportunity to introduce Emma. Actually, just imagine what if the country can provide therapeutic massage for everybody at a super affordable cost, as low as like $1 per session at our national cost. So you don't need to bother like if everybody goes for a therapeutic massage, you get being healthy, then it costs the nation a lot of money because automation is there to help. So we are actually a research team from NTU. Now we are a startup to develop Emma, and we hope that we can have integrate master plan with supported by clinical studies and implemented with controlled sensors and actuators to provide a kind of personalized and systematic care to the patients in future. And right now we are being supported by Mayo Clinic for the pilot clinical studies. So we are actually discussing to go further. And in Singapore, we are probably have in the next few months, we are going to have study for constipations with Emma on different acupoints and meridians with NTU and NUSH, and probably non-specific lower back pain studies with Emma later as well. So eventually, we hope that just now there's one question you asked about how can we find quality care, like something you can trust, right? So the question comes because TCM sometimes is we don't know what they will provide. So the Western part is that they provide something which has passed the rigorous clinical studies, right? So at least for the trainer part, we want to have clinical studies for every single problem. And over years, like a decades or 2 decades, like 100 years, but we will keep it on. Like a lot of researchers will try to do that. So eventually for all different kind of problems like knee problems, shoulder problems, neck problems, cervical spondylitis, there are proven systematic clinical studies behind it for each single procedures, which are carried out by the robot, which is no longer not hired. So of course, we are also supported by Parkway Shenton. Like they had Emma with their tool of their centers. I think this is a great encouragement for us too. So you can have a try sometime in NTU soon.
Thank you, Albert. I want to add to what Albert just mentioned, right? Because again, it's a matter of how to make it accessible, how to make it more affordable, and somehow you just have to turn to technology, because fewer and fewer young people are willing to do the labor-intensive kind of treatment. Even when you go for physiotherapy, right? The physiotherapists most of the time just ask you to do exercise on your own, right? Many of them, will not have the energy or the patience to really do very heavy-duty manipulative treatment on a patient. So we have to rely on technology like robotic technology, more sensitive sensor. So all these will improve over time. But what is important is we want to make sure the original theory of whether it's Western medicine or traditional Chinese medicine is properly built into this technology, right? So that the efficacy will stay. And we want to kind of maintain the trust of all kinds of treatment, even though we are using the new technology, but the ancient wisdom in some of this traditional medicine is retained in the new technology to provide more affordable treatment to people. Yeah? There was a question. Anyone new has any question? Oh, yes, wait. Sorry.
It's okay. My wife would be really, really pleased if she could have a foot massage for $1. So I think she would do it every day. Fantastic presentation, is very, very interesting for Dr. Yin. Two things. So the images that you showed are really spectacular and very interesting to see the difference between, let's say, people who are suffering something and people who are healthy. But could you get a little bit more information about the treatment, what that treatment is? Is it kind of electromagnetic stimulation, or is it a vibration caused by this kind of stimulation externally? And what's the duration? Is it 1 minute, 5 minutes intensity? A little bit more description of that. And second, so of course, one of the things we all like to think about is prevention. So how can this kind of approach be used to study issues like sarcopenia, which is mentioned already a big issue in Asia and globally? How could we use this sort of imaging to understand better what is causing this, let's say, deterioration or the extra adhesion that we see?
Sure. So let me start with the first question. So our imaging method is actually, if when you say what exactly this intervention is, I think might be a little bit misunderstanding. Maybe it's because I didn't really explain it really well, so I have to apologize first. So actually our MRI elastography, which is we do vibration, right? That is have zero therapeutic approach in it, built in it. We are literally just vibrating very gently. We're trying to introduce this passive motion, because every time you want to measure mechanically something, you have to let it move. Otherwise, it's a dynamic properties to measure. So we need to, with that MRI vibrations, to let the waves get into it so we can start to analyze the tissue. So in other words, it's a purely imaging diagnosis tool. There's no intervention there. In terms of time and duration, and our scanning time is literally about 4 to 5 minutes. So it's not a kind of a long scan or anything. So it's a pretty kind of a practical. So do you have any other thing with MRE? Sorry, I kind of forgot with their.
Yes, the use of this kind of technology for studying causation, right?
Oh.
What is the cause of that extra adhesion? And of course, eventually could it be presented maybe by Chinese medicine or other?
Absolutely, absolutely. So when you whenever you want to get into the mechanisms, then we have to come sometimes at least male, we have to come to animal models. So because animal model is well controlled, we know what could cause this adhesion, and then we can tease apart each individual factors. So there will be the animal studies actually. If we prove, at least we have to prove NIH, and also NIH is very pleased by our results. That's why we are getting a lot of talks on their annual workshop. But once we prove that this is effective, and we definitely going to come into the animal studies, trying to build animal models, injury models, to understand in what situation, what is percentage of this hyaluronic acid, how it affects our adhesion levels. But one thing I want to make everyone clear is that we are really trying to get the imaging biomarkers to prove something like TRINA is useful. I think that is emergingly people trying to get. Okay, you know it, I know it's useful, show me the evidence. And as long as there evidence, people will start to understanding this, accept this, and they want to try this, but they need some evidence, at least in the Western countries, I think. Yeah. Mm-hmm.
Thank you, Dr. Yin. There's another question from the online audience for you, which is kind of similar. The question is, you talk about manual manipulation being used as an intervention for improving myofascial elasticity. How about other kind of intervention, for example, heating modality or hot packs, infrared radiation? Can they be, has improvement been observed in MRE?
Absolutely.
This is asked by Dr. Christian online.
Yeah, that's a great question, actually. The heating actually is particularly useful. It's also, I think it has a similar reasons behind it. It's because the hyaluronic acid that I just mentioned, it will become more lubricating when the temperature actually goes up. That's why when you apply the heating, you kind of lose up that structure based on animal models again. I think it's sometimes hard to do with the patient. And with that, when you heat up that region with the temperature increase, the hyaluronic acid become more lubricating, actually more effectively in transfer the motion. So I know there's a lot of studies in the NIH and also in the research community. They're trying to treat this hyaluronic acid or adhesion with the hyaluronic acid injection, or kind of detangle its kind of bonded structures, also the heating pattern improvements. So our techniques, as long as we are able to see that separation of the mobility plan, we should be able to also see the effects of those as well.
Okay, we are running out of time, but there's two same questions from the online audience I have to ask. The simple one is probably for both Dr. Yin and Professor Zhong. The question is very simple. For the TRINA treatment or for the MRE study, how many sessions of treatment is required before you want to measure again with MRE, or you think it's sufficient to have an effect?
So I'll start first.
How many sessions?
Yeah. So at Mayo Clinic for clinical intervention, we start 3 weeks, and we do the MRE after each treatment, right? Immediately after treatment, we will do an MRE and to see the difference. So, and our clinical partner, like Dr. Bauer and his practitioners, just 3 weeks is a pretty decent kind of a course. You can see an improvement.
Yeah, I think from the perspective of research, it's better to observe before and after treatment immediately, and then follow up. Maybe follow up for every week or every month. But in our clinical practice, usually we will have 1 month, like continuously treatment, and maybe each week you will have 2 duration. You will have 2 sessions of treatment.
Yeah, exactly. It's like twice a week for 3 weeks. I think we're in the same range.
I think only once, maybe you cannot see the effect. So for continuous treatment to maintain the effectiveness, I think 1 month is okay, optimal, and maybe you can follow up, stop the TRINA, and then you can follow up for another 1 or 2 months, then using different approaches of assessment. Yeah.
Okay, I can also share our clinical study for TRINA and physiotherapy. For the study, I think we do 6 treatments, correct, Xiaoxing? 6 treatment over a period of 2 months, I think. And then we did the measurement 2 months later and 5 months later. So it shows that, you know, even after just 6 treatments, there was a long-lasting effect. You know, I can reveal a little bit of the outcome of the research. You know, the effect of Tuina is no inferior compared to physiotherapy, right? Meaning we compared 2 groups of patients. One was treated with the physiotherapy, the other group with the Tuina, and after 2 months and 5 months, we did the measurement. The improvement was at the same level. Yeah, so that kind of partially answered the question as well. Okay, thank you very much. The audience in the auditorium as well as those who are online. Thank you for coming to our dialogue, and also thank you very much, Dr. Yin and Professor Zhong.